Well, it's time to do a catch-up with our favourite minister. It's our minister who puts himself forward anyway to come on this. I'll get lots of mail about that now, won't I? David Ashford, hello. And this is a Monday recording. We had you had issues on Sunday, but still lots of things to talk about. I know Monday is normally a day that Cohen has a sitting, and there will be more announcements as the day goes on. Is that correct this week as well?
There is. Council and ministers have sat this morning, and the Chief Minister will be making further announcements at the press conference this afternoon. It's
Pool B, so I'm not there, but should we be excited?
I think there will be things of interest to people. No spoilers, I'm afraid. Paul.
No, I understand. Well, let's do some questions, and we had quite a lot in. Now, some are probably dated and maybe over, so do excuse us for that, but I think it's worth asking questions so you can clarify. When should those in high-risk categories who were originally advised to shield due to underlying medical conditions expect to receive a revised letter? It's been promised for 2 weeks now and no sign. My husband is in the category and is comfortable that the risk is now sufficiently low enough for him to return to work. Social distancing can be achieved. But his employer is insisting on a revised letter. The consultants won't provide anything, as it's up to the individual. He is effectively signed off for 10 weeks now, and it needs to be signed back if fit to work, but no one will give him the written confirmation that he needs.
Well, in terms of the letters, Paul, they went out last week, so hopefully the couple should now be in receipt of the shielding letter. The advice now basically is with the low or even zero transmission risk in the community. For those shielding and in the vulnerable category, it is entirely up to them now. There is no requirement for the social distancing. We are saying that it is fine for them to go out, to meet family, friends, and start restoring their life to normal. Now, I fully appreciate for many of those in the vulnerable category that in itself will be scary, this change in advice, because they have been shielding for 12 weeks or so. But what I have said to people is that, they should take it at their own pace. If they don't feel comfortable going out, if they don't feel that they're ready for that, then that's absolutely fine. There's nothing wrong with that. They should do so at their own pace. But we are saying as a department, there is nothing now to prevent them to going back about their daily lives.
Right. This question's come up from time to time. It may have a different answer now, but why have we not got a track and trace app here on the Isle of Man when it seems perfect for such a small community to have that way of doing it rather than how it's been done at the moment?
Apps are great when they work, and they're great if you can get the take-up. In order for a track and trace app to be effective, you've got to have roughly around about 40% of the population using it. Evidence from around the world where apps have been in place is that has fallen well short for various reasons, conspiracy theories about how the data will be used, various things like that. People aren't taking them up. The best app with the best take up around the world, as far as I'm aware, was Singapore. Now, Singapore as a culture is very much cultured around trusting their government, believing their government is doing the best for them. And the take up in Singapore, the last time I checked, was 18%. So still well short of the 40 that's needed in order for an app to function effectively. But also here on Ireland, we've actually got a physical track and trace, as in it's being done by people are following it up. And personally, I think that has been much more effective than any track and trace app ever could be. And
the UK, they had this trial on the Isle of Wight, but it seems to go quite quiet. I don't know where they're up to on that. Do you think that's failed there also in the UK?
It's gone very, very quiet, is what I think I would probably say on that. And certainly it hasn't seemed to have been mentioned for the last couple of weeks. And there's certainly been no announcements about a wider rollout yet in the UK. Like I say, you really need about a 40% uptake of the population for any app to be effective.
Next question. Is the Isle of Man taking cruise ships bookings for next year, given the experience of the virus infections amongst passengers and crews? One thing is allowing a comparatively small number of holidaymakers into the island, but a ship carrying 2,000 or more passengers is surely something different. What's the government position on this?
Well, it's impossible to say, Paul, where we're going to be in a month, 2 months' time, let alone in 12 months' time. What I would say about cruise ships, though, is if you actually look at the data, obviously there was the high-profile cases, There was 3 instances around the world of major outbreaks on cruise ships, but in terms of the entire cruise industry, that's actually quite low. The cruise industry was one of those industries that reacted very early to COVID and managed to actually contain it. So when you consider the amount of cruise ships that travel around the world, or certainly did at that point in time, and the number of passengers, they contained any potential outbreaks very well. But it's impossible to say where we will be in a year's time. Obviously, at the moment, we have border restrictions, etc. And as I've said continuously, anything that we do won't just be dependent on us and our situation on Ireland. It'll be dependent on our near neighbours as well.
And I guess anyone getting on
what COVID-19 is doing around the world.
Right. I mean, anyone getting on a cruise line ship anyway, when it does restart, I should imagine there'll be a massive amount of testing going on there anyway before they even get on it.
Well, the cruise liners were one of the first to introduce testing. But again, I put the caveat on that the only test they can really do is a temperature check. And as you know, we've had long debates about the usefulness of temperature checks.
What is the estimated amount of people who will become unemployed due to the incoming economic recession that's come to the island because of the virus?
Well, at the moment, obviously, we saw a spike in unemployment due to obviously people being furloughed or people actually losing their jobs. One of the biggest sectors affected is the construction industry. Looking this morning at the data, the live data now of unemployment, quite a lot of those jobs are returning. Obviously, retail has been impacted as well when we shut the non-essential retail. That's coming back online, and we are also seeing a drop in the unemployment in that sector. But the long-term impacts will take several months before we actually see the trend data coming out.
Are you worried?
I think we could have been in a much worse situation. We've been able to move a lot quicker than other nations to reopen bits of our economy, but obviously you've got the tourism industry that has been massively impacted, and I think it's something that we're going to see around the entire world. I mean, you look at the UK and the recent announcement of 25% down on GDP just in the last couple of months, which is actually an historic record since records began in 1701. So it is going to have an impact, there's no doubt about that, but it's going to take several months for the data to settle down before we know exactly where we stand.
All right. Free parking. Are the government willing to drop the rent for Douglas Borough Council to continue to offer free parking to protect our delicate retail sector and essentially protect our economy? From a public point of view, at least on the next month or so, it's going to be awkward to gauge how long to park, as some shops will have queues outdoors and others won't. And it takes a lot longer to do shopping that way, and it's hard to guess how long to pay for. So some will opt to go online and won't have to worry about it.
Well, obviously, I think since that question's come in, we've had the announcement around the social distancing, which has changed today. So shops won't necessarily have to have the same queuing systems that they did have previously.
But they only let so many people in the shop, won't they, at any one time, I'm guessing, at the end of the day, won't they?
Well, that will be up. That will be up to the shop. There is no longer any requirements on social distancing. Right. So shops can go back to operating as normal if they so desire. Obviously, that is entirely the choice of an individual business. There's some that believe that the right thing for them and their customers might still be to keep that in place, but there's no requirement for them to do so. In relation to the parking, I know there's been conversations going on between Douglas Council and DOI in relation to the agreement that's in place for the council to operate the car park on DOI's behalf. At the moment, they haven't concluded an agreement whereby the rent will be waived, but I do know there's been other conversations going on between the two parties.
And the walkway won't be open again for parking because they've now, with the one-way system, designated this as an emergency lane, haven't they?
Yeah, and it is important that the prom carries on. I know there's going to be a lot of frustration about the prom one way, but one of the key things is to get the promenade done now and get it done as quickly as possible, because next year we are hoping we will be in a position where the tourist industry can reopen as normal and can actually start a season. And the last thing we want, which would be an absolute nightmare and it would be completely unacceptable, is to be turning around to tourism premises who've been impacted this year by COVID and saying, actually, this is your first real season back, and the first thing we're going to be doing is cordoning off the road outside your frontage. That would be the double blow and absolutely cripple them. So it's important we get the promenade done. Right.
I appreciate it's not your department, but on the day of recording, it's gone one way, and we've got all the social media's gone crazy with what's going on Glen Crutchfield Road, and there's been an accident at least up at the top of Victoria Road, with this going down the dip and around the old TT circuit. Is this keeps coming back to the fact that things maybe could be signposted better? I mean, using a cliche by saying that, but to advise people about these changes, rather than they seem to wake up and find that they've got a bus lane and a cycle lane and only turn left lane happening without what they appear to have any consultation on it.
Well, I think DOI, to be fair to them, has worked long and hard on this. It hasn't just suddenly come about. They've been working on it for several months as to how it's going to work. I must be honest, I haven't this morning been personally out and seen it yet because I've been in Council of Ministers all morning, so I'm not aware of any of the instances you raise, Paul. But it has been worked at, and as with any of these things, it's all very well putting the planning in place. It's how it works in practice. And you don't know that until it's actually up and running. So I'm pretty certain that DOI, if there is any issues, as they have with other schemes, will look at it and make tweaks and changes accordingly.
You issued a statement in April saying the rollout of continuous glucose monitoring for type 1 diabetes would be delayed by 3 months because of the coronavirus. There's 1 month to go, and in light of the progress made, what reassurance can you offer the families of people with diabetes?
We are looking to get that up and running as soon as possible. People will know it's been a long-held belief and campaign of mine to get these monitors available, not just for children, but also for adults. I believe it's the 21st century way forward. We unfortunately, with the advent of COVID-19, did have to delay the rollout. But now, as we start to restore services across DHSC, it's one of the things that I'm keen to see back in action and getting the rollout up and running again. And certainly it's something I've already had conversations with the executive team over.
The public are being asked to respect the fact that other people may wish to remain socially distancing. Now, without wearing a T-shirt or high-vis, nobody would know who it is. So what do you recommend for social distancing? In public, should we carry on doing it? Is really the message here, do you think?
I think it's more about respecting people's space. So it's about not being immediately, if you're in a supermarket or something like that, not immediately pushing up behind someone. I think it's each to their own now. I mean, we can't continue with having in place 2 meters, 1 meters, when there's absolutely no requirement for it now. It's important for people to make their own choices. I think just people need to be aware that the situations they are comfortable with, others around them might not. So if there is somewhat, so don't automatically invade someone's space, which I think is a good rule for being out and about anyway, Paul, in general life, to be honest.
Sure. I mean, I think we all act differently now. I mean, I don't know when I'm going to handshake anybody for some time to come, probably, but that's just the way the world is moving, isn't it, I suppose?
And you've got a mask for every occasion as well, as you showed us the other week.
There's a lot of feedback about that as well. Anyway, how can cafes and restaurants open indoors with unlimited numbers of people, but gatherings of more than 30 people outside is still prohibited? And the issue about pubs, which it confuses me. You have to have a big meal as such. I'm sure there's going to be an answer to this later today, but as it stands, a pub can only indoors.
No spoilers in regards to the announcements later by the Chief Minister.
Right.
The gatherings rule obviously was brought into place. The reason we brought the social distancing one forward, and I think that's important to clarify, is when we realised that the transmission rate was so low that we were now getting to a point where we were past 1 incubation life cycle of the virus, heading towards 2 incubation life cycles of the virus, and it was okay to remove social distancing. We'd of course previously made an announcement of going to 1 metre. Now there was a lot of businesses, including pubs, clubs, etc., who were starting to gear up for whenever they could open, who were already working to that 1 metre rule, and we didn't feel it was fair for them to go a whole nother week preparing, spending money on doing that when we knew we were going to go to 0. So we literally announced the social distancing as early as we could so we could get the message out there so businesses didn't spend money unnecessarily over something that we were going to then change 4 days later. So at the moment it probably does look a bit disjointed in relation to gatherings, to inside the household, etc., because we brought that announcement forward in relation to social distancing. But I can assure you, Paul, there is a bigger master plan, and I'm sure the Chief Minister will speak more on that this evening.
We're building this up for 4 o'clock. This one also, it's about burials. Can people and families go ahead with burials with the loss of their members, family members, and can they meet at gravesides from now on?
Yes.
Oh, that's good. Well, thank you. Why did it take until today for the government to open the Villa Marina Gardens? I've changed that one because I saw it was on today, because the last time I was looking it was still shut, but that has changed today, hasn't it? But why did it seem so long to leave the garden shut?
Well, one of the things with the gardens, of course, is it's around space and access to space. We took a decision early on as a government that we would lead by example on government sites, and we would shut things off, and that we would shut things down. That included the Villa Marina Gardens as a public space. Now that the transmission risk is so low and social distancing is being removed, that is the appropriate point to open it. We didn't want to open things that would encourage illegal gatherings. And
on the Manx National Heritage sites, I mean, Peel Castle, but I haven't heard about Laxey Wheel yet. Why again the slow rollout? Surely it should be quite simple. If it's an outdoor place, with a few things in place, it should be open to the public again, shouldn't it?
Well, let's remember, Paul. Well, again, I'm not going to preempt announcements that are going to be made later. But one of the things I would actually say is, while social distancing was in place, don't forget a lot of these places that you mentioned, not the Laxey Wheel so much, but certainly some of the other heritage sites are indoor sites. And again, the recommendation at that time from Public Health was people shouldn't be in an enclosed space for longer than 15 minutes, less than 2 metres apart. Some of those heritage sites are nigh on impossible to do social distancing within, certainly the 2 metre rule anyway. It just wasn't practical, so it was better to keep them shut. In terms of the social distancing reversal, going down to 0, that was literally agreed by council and ministers on the Thursday morning, and we announced it on the Thursday afternoon. Okay. So when you think about it, there's only actually been one working day since we announced it to start moving things forward.
Good. Well, there's our questions for today. But I have to ask you, I mean, the Isle of Man, it has had the media spotlight on it. I saw the Chief Minister was on BBC News over the weekend. I got dragged on to Good Morning Scotland at an unearthly time. Did you end up on Lorraine? Because I was hearing you might.
No. I told you the rumour was false, Paul. But you wouldn't listen to me.
No, well, you never know. Have you? But it's been positive, I think, from looking at the media I've been following. We have made a positive piece of news on this, do you think, or will it come back to bite us?
I think we have, and again, it's thanks to the Manx public who have done exceptionally well throughout this. It's been a very disconcerting time. People's lives have been upended, basically. We've asked people to go against their normal routines. The Manx public has listened to the advice and they followed it. And this is the result we find ourselves in. I mean, again, I always like to end on a cautious note. You know me, Paul. We're not out of the woods. It doesn't mean there won't be any more COVID cases identified on Ireland. There is always likely with any virus to be the odd case here and there. But the reason we are in this position is because the public of our island have responded so well to it.
I guess I should actually quickly ask you about the situation at Abbotswood with the police getting involved. Is that something you expected? Are you comfortable with, or does it not affect your particular inquiries?
Well, the DHSC's investigations are obviously now suspended because it is now a police inquiry, and I can't comment on ongoing police inquiries. That is now a matter for the police.
Okay, well, the 4 o'clock briefing, which is today, Monday, we're recording this on, so if you're watching this after that, it could be a lot out of date. There's going to be more announcements today, but do you think as the rest of the week as well, or is it all going to be done today without giving anything away?
No spoilers, Paul. You know me. Giving you any spoilers in advance, you will have to wait and see.
Fine. Well, if we've got people who still want to talk to you next week, hopefully we can do another one. Obviously, the world is changing by the minute, so who knows? But thank you for your time.
You know where I am, Paul. I'm at your disposal.